Hi, my name is Thelma. I'll be your nurse for today. What is your name? And date of birth, please. Okay, so today we're gonna be doing the musculoskeletal assessment, and first I would like for you to walk towards me, so I make sure your walking is symmetrical. All right. Next thing, I would like for you to do for me is I would like for you to open your mouth and close it. I want you to move your jaw from left to right. Next, move your head left and right. All right, and then the next thing I would like for you to do for me is to look back, look forward. All right, that looks good. um Next thing I will like for you to move your head forward and backward, and then we're gonna have to test the muscles in those areas. So I'll put my hand underneath your chin, and it will have you open your mouth. Okay, close. That's good. So I'll move your jaw from left and right, and then you turn, and then other way, and that looks good. Next thing we're gonna be looking at is to um, adduction and abduction, and then we're also gonna trace the muscles in those areas to make sure everything is good. And then the next thing we're gonna do like we're gonna do the flexion. So I'll have you um I'll have you put your hand um forward, and then gonna flex your hand like this backward, and that looks good. I'll put my hand on your shoulders and have you shrug. And then the next thing we're gonna do is we're gonna do the elbow assessment. Okay, next we're gonna move to your elbows. So I'll have you put your elbows up. I'll put your elbows like this, straighten that out. Okay, that looks good. And then we're gonna do the supination, and then the pronation, and then also we're gonna go ahead and test the muscles in those areas. So I'll put my hands and I'll have you pull, and that looks good. And then your muscles, I'll pull up and down, and that looks good. Also, I'm gonna have my hands like this, and I'll have you push them to test the muscles. And then the next thing we're gonna look at will be your wrist. So I'll have you put your hands like this for 60 seconds to make sure that it's okay. And then the next thing we're gonna do is we're gonna do I'm gonna tap it. Do you feel any pain? All right, next thing we're gonna do is do the extensions, lower, upper extension, and that's good. So, and then the next thing we're gonna do is we're gonna be doing the radial and the ulnar. Next we're gonna do your fingers, and then we're gonna do abduction, and then we're gonna look at the muscles in those areas. So I'll put my fingers, and then I'll have you pull to test on the muscles in those areas. And then the next thing we're gonna do is, and then I'll have you sit back on the bed so we can do the abduction on your knees and your leg, and also perform the flexion rotation. And then the next thing I'll have you stand up again, and then we're also gonna do the hip assessment, where you have to bend down and then you stand up, and then I have you walk again, and then make sure everything is symmetrical. And then I'll have you I forgot this, move your hips. And then because I can't explain this since I'm doing this by myself, I can show you how to do this, but this completes the assessment. And then if you need anything, let me know. I'll put your collar by your side. And also if you need anything, you let me know. And also to do my ASVR, I'm going to hide my name is Thelma. I'm taking care of the patient in room 100. I realized that one of her fingers are not really moving, so I don't know if you can have a therapist go in there to try to examine that finger and make sure everything is okay. And the patient was brought in yesterday at 5 a.m. in the morning when she was complaining of muscle stiffening. Thank you.